Now, the Health Minister, Stephen Donnelly, announced yesterday evening that people aged 80 or older and residents of nursing homes aged 65 and older will receive a booster COVID-19 vaccine. Now, joining us to discuss this is the Chief Clinical Officer with the HSE, Dr. Colm Henry. Colm, just tell us about this. What vaccine is going to be used for the booster? When is it likely to happen? Just give us a little bit of the detail insofar as you have it at this stage.
Thank you for having me on, Shane. So, this reflects the emerging evidence that there's waning immunity in certain groups even after they've been fully vaccinated, and particularly in older people. And of course, we know the particular risks of older people in residential care settings. So as the evidence emerges, NIAC is issuing the advice to us through, of course, the Minister of Health. And that advice, as we learned there a week or two ago, first of all, that the primary dosing schedule, that is the number of doses in that first round for somebody, needs an additional dose in those people in immunosuppression. And laterally, as we found out last night through the correspondence, that we now want to extend a booster vaccine in recognition of the waning immunity in particular groups, older groups, to those aged over 80 in the community and those over age 65 in residential care facilities. So we'll be going through the advice that's provided by NIAC, which comes with a lengthy document explaining the rationale behind it and so on. And we have to translate that advice into what we've been doing with the vaccination programme from the very beginning, is getting the best medical advice and translating that into real action and to jabs into jabs into arms.
And specifically, I mean, a lot of these people, I think I'm right in saying, correct me if I'm wrong, would have got the AstraZeneca vaccine initially. Will that have any influence on what jab they get this time around? No,
the booster jab will be what we call the mRNA vaccine, which people will know it as either the Pfizer or Moderna vaccine. That they're the vaccines we'll be given. And there's good evidence that anybody who previously received the AstraZeneca vaccine and gets a vaccine with Pfizer or Moderna, that it's safe and it's effective and it stimulates a good immune response. So that it will be the mRNA vaccine that will be given as the booster vaccine.
Okay. Are we all going to be getting a booster in the coming months, or are the likes of myself and yourself, are we still some way off that point?
I think time will tell, and that's I know a frustrating answer for people to hear, but we do rely on the evidence. We want to make sure that it's safe, and it appears that giving a booster vaccine is safe in the groups I've mentioned. It has to be effective, and that's in terms of invoking this immunological response, lots of antibodies and the other parts of the immune system, so we know that fight that famous spike protein on the virus. And we have to know that it translates into an immunity that means something, that in terms of reducing serious illness. And we know that's very effective. We look at our own hospital figures and our numbers of cases we're identifying now, and the trends are really very good and very optimistic. It should give encouragement to everybody. So we're trying. The purpose of this booster program is to build on those gains that we've seen over the past weeks, months with the vaccination program, and keep people safe, especially those who are most vulnerable in the community.